How's it going, guys? We have a past level question, Biochem Pharm, step 1, 16-year-old boy, significant muscle pain in the legs after 2 days of snowboarding 8 hours a day. He's given ibuprofen, NSAID, and they just want to know what's most likely seen his patient. Okay, very bread and butter, past level stuff for USMLE. Let's just whip through. Choice A, decreased production vasoconstricting prostaglandins, wrong fucking answer. Even though you're giving a COX inhibitor, NSAID, ibuprofen, you're inhibiting the production of OMG, vasodilating prostaglandins, not constricting. I mean, you got to know that, and students do fuck it up. Now, what's going to happen is on the NBME/USMLE, they could give you a similar question, ask you for what the effects of the kidney are for giving an NSAID, and the answer will be decreased production of vasodilating prostaglandins at the afferent arterioles. It's very, very important going to the kidney. Okay, they'll have all the different combinations, constricting, dilating, efferent, but it's vasodilating prostaglandins to the afferent arterioles. Regardless, choice A, wrong fucking answer. Choice B, decreased release of intracellular autoclave. Nebulous sounding answer choice, wrong fucking answer. First to mast cell stabilizers, i.e. netochromyl, chromal, and sodium. An autocoid is a chemical mediator that acts locally. It's not the same thing as paracrine function. It's not a hormone per se, but when you give mast cell stabilizers, you're decreasing the release of histamine. Okay, so histamine is an autocoid. It acts locally, so decreases the release of histamine from mast cells and basophils. Okay, and I've seen this as an answer on one of the forms for netochromyl/chromal and sodium. Choice B, wrong fucking answer. Choice C, decreased shunting arachidonic acid, wrong fucking answer. So when you block COX and you decrease the synthesis of prostaglandins, you're going to be shunting arachidonic acid down the lipoxygenase pathway, resulting in choice D as the correct answer. So arachidonic acid is the precursor to both the cyclooxygenase pathway for synthesis of prostaglandins, prostacyclins, leukotrienes, the fuck am I saying? Prostaglandins, prostacyclins, thromboxane, and platelets. You're going to decrease the synthesis of those three when you give a COX inhibitor, i.e. aspirin, ibuprofen, etc. Arachidonic acid is going to get shunted down the lipoxygenase pathway, which makes leukotrienes. So leukotrienes go up arrow, okay? And it's exceedingly high yield that you know leukotrienes cause bronchoconstriction, which is why choice C is the wrong fucking answer, okay? So they want you to know on USMLE about aspirin/NSAID-induced asthma / hypersensitivity to NSAIDs. They'll tell you a snowboarder took ibuprofen for muscle pain and got wheezing, and they'll say which should be avoided in this patient in the future. The answer is aspirin. Acetaminophen's wrong. Acetaminophen's not an NSAID. It acts centrally within the brain, doesn't act peripherally. Okay, so that's what they want you to know for USMLE. So you're increasing shunting of arachidonic acid from the precursor, both the cyclooxygenase and lipoxygenase pathways. You're shunting it to the leukotriene pathway. And xylutone, you could know, is a drug that inhibits lipoxygenase. And then montelukast, saferlukast block LTCDE4 receptors for leukotrienes. Okay, they can technically be used for asthma, all those drugs. LTB4 is a neutrophilic chemotactic receptor. Okay, so, it enables that. Choice C, wrong fucking answer. You know the deal. When you make more content and stuff, going to. Appreciate your time. That's it.